Hi everyone, I'm Sophie and welcome to the video. Today I'm going to be talking about end-of-life care in a hospital environment. Working in elderly care, I have looked after a lot of dying patients. However, my first proper experience with death was with my great-nan when she died in a hospice. She was surrounded by her family and it was a really nice, peaceful way to go. So that was my first experience with death, and from then I have had quite a few more. But I think that having a comforting memory of death kind of makes it a bit easier to cope with when you're dealing with it nearly every day. A patient will be made end of life if they have deteriorated and there is no sort of sign of them getting any better. It's a consultant's decision at the end of the day. As a nurse, you can express your concerns and your worries about the patient if you feel that they are not going to get any better. The patient and the family will also be involved in the decision, but where I work, a lot of the time the patient may not be able to make that decision, and a decision is made based on the best interest of the patient. When a patient is started on end-of-life care, they will have a end-of-life care pathway. This is what the one in my trust looks like on the front. All trusts will have one. They might be the same as this or they might be a little bit different. It just depends on what trust you are working in. The consultant will fill out everything in this care booklet regarding the stopping of treatment and things like that. Patients who are end of life will usually stop having regular medication. However, they will be started on anticipatory medications such as midazolam, oxycodone and morphine. These medications are for the comfort of the patient. They're to help with any pain and agitation that the patient might have. These medications can usually be given every 2 hours, so just administer them when applicable. Within the pathway, the consultant will also write down whether you are to continue with observations or checking blood sugar levels and things like that you'd be doing for your patients who aren't end of life. The main thing for patients who are end of life is to make sure that they are comfortable. They're not going to get better and they are going to die, so making sure that they are comfortable while that is happening is the main priority. As I touched on earlier, the patient will have anticipatory medications. If you notice that they're being given every 2 hours regularly, the doctors will be able to prescribe a syringe driver. I think there's a bit of confusion with what syringe drivers actually are. A lot of people think that they are to help kill a patient and to aid them in dying, and that is not what it's for at all. Syringe drivers are made up of different medications to help the patient be comfortable. So like I said, you'll have your morphine, your midazolam, you'll have medications to help with secretions. It's just to keep the patient pain-free and in a calm state, basically. A lot of patients who are end of life will also stop eating and drinking, and that is completely normal. Do not force your end-of-life patients to eat and drink. If they don't want to, they're not going to. However, it is important to keep up regular mouth care. As they are not hydrating themselves, their mouth is going to get really dry and really sore. In the hospital, you get little mouth care packs and they have little sponges in. Just whenever you come in and check on them, little dip in the water and just moisten their mouth with the sponge. Also putting like Vaseline and stuff like yellow paraffin you have in the hospital, pop that on their lips just to keep them hydrated because they can't do it themselves. As important as it is to be looking after your patient when they're on end of life care, it is equally as important to look after the family. The family are going to be losing a loved one, someone that they might have spent their whole life with, and they're seeing them in this state, and it can be very upsetting and can be really difficult for some people to cope with. It is your job as a healthcare professional to look after them as well. Make yourself known to them and let them know that you are there for them if they need anything as well, even if it's just to have a chat about anything. You know, you're there for the support. It's going to make them feel more comforted knowing that there's a good nurse and a supportive nurse looking after their relative. If you don't work in healthcare, then you more than likely don't really know what happens when you die and when you are dying. In my pathway, there is a page for the families, and you basically tear it out. It's this page here. I will take a photo or something and put it in a document, and you can have a read of it, about what happens when a patient is dying. It talks about medications and not wanting to eat and drink and sort of withdrawing from the world and just being in their own little bubble, as it were. It's important to go through that with the family, because like I said, some people think that the syringe driver is to kill someone, and it's not. It's little bits of confusion here and there that needs to be cleared up so that the family actually understand what is going on. A lot of the time the family will be there almost 24/7, and a lot of hospitals will have a room for patients' relatives to go and stay in. On my ward, we let the relatives stay. They can stay all night, they can stay all day. It's entirely up to them. With end of life, it could be any time that a patient dies, and a lot of families like to be there when it happens. Sometimes they don't, and that is up to them. They don't have to be there. It's their own way of coping. And sometimes they go home to have a little break, and you might notice that the patient looks like they're going to die. So phone them. If they're for 24-hour call, phone them and get them back in, because if they want to be there and they are not there, that is going to affect them just as much as them actually dying. If a patient doesn't have any family that is going to be there for them when they die, I like to sit with them just to comfort them and just so that they're not on their own. I think one of the most terrifying things is dying on your own, especially in a hospital. In my hospital, when someone is put on an end-of-life care pathway, all other documentation stops. So turnarounds, fluid charts, daily care plans, all that is replaced by this, just so that everything is in one place. You get continuation sheets for these. Just make sure if you're writing in it, you sign the front bit, and when you check on your patients, so this is what it looks like basically. So you have what you are doing, so ensuring the patient is safe, ensuring that they're pain-free. So if they look like they're in pain, give them some medication. All the little bits that are in here, and you basically write the time that you go in and you sign it. Now usually you should be doing it every 2 hours. You can go in more often if you think you need to. It has a bit for if you're turning them down here. So you say what time you went in, who went in, and what side you've put them on, right, left or back. Some patients' families don't like you turning them every 2 hours, and to be perfectly honest with you, if they're going to die, they do not need to be turned every 2 hours. They just need to be comfortable. If they have slipped down the bed and are all skew whiff, yep, go and get them more comfortable, go and turn them. But if they look really comfortable, just leave them. Just leave them, because it's going to cause them more stress being turned and being pulled up the bed than it is to not. Then on the final page, it just says what nurse is looking after them on each shift, so an early, late and a night shift. The last thing I want to talk about is caring for someone after they have died. So when a patient has died, you will usually know, because they will have stopped breathing, they won't have a pulse, but you need to come and get the doctor to certify. There's been a bit of confusion whether you should or shouldn't phone the family before a patient has been certified, but you know when someone has died, they look dead. They're not breathing, they don't have a pulse. So if you want to make that phone call, you can make that phone call, but just say that they haven't been certified yet, but they have died. It can be a really difficult phone call to make, especially if you haven't done it for the first time. In my trust, we have a bereavement care booklet, and basically you phone the family, you say, I'm really sorry, but your relative has died. Say that they were peaceful. If someone was with them, tell them that someone was with them. And usually they just want to know what happens next. And that is what the bereavement care booklet is for. Basically, you give them that phone number. This is what happens in my trust, is you give them the phone number of bereavement care, and then they are to phone bereavement care the next day at about midday, 1 o'clock. That is where they get all the death certificate from. Bereavement care basically look after them when a patient has died. Whatever time it is, ask them if they want to come and collect the belongings of the patient, and if they say yes, store them in an appropriate place, so that when they come in they can go and get the belongings. Also put a copy of the bereavement care booklet with the belongings just so that they have that there. When you go in to do the last offices of a patient, it can be very strange if you've not done it before. My first experience with it was with my granddad, and I had already gone through 2.5 years of nurse training, and I had never done it. The placements that I had up until then didn't really have people who died. It was really strange, but working in elderly care, someone dies once every couple of weeks, sometimes more in the winter. But go in, be respectful, talk to them as if they are still alive, tell them what you're doing. I think it makes it more comfortable for you to treat them as if they were alive. In my trust, we open the window when someone dies. I'm sure they probably do that everywhere, but just be aware of that. And what you'll do with last offices is just give them a quick clean. Make sure that they are clean and not covered in poo or wee or anything like that. With end of life care, it is expected death, so you can take out any invasive things. So if they have cannulas, if they have any subcut needles, if they have a catheter, if they have a flexi-sig, you can take all that out. Once you've given them a quick wash, you'll put on a shroud and put them in a body bag. While you're doing that, you'll be writing out in the you have like a little death book, and you write down the patient information, when they died, which is the time that the doctor comes to certify, and you put one on the shroud, one on the body bag, one in the medical notes, and one stays in the book, basically. So there's 4 little bits of paper. Pop a slide sheet underneath them, just so when the porters come, they can just slide them onto the trolley. Once you have done the last offices and they're all ready to go down to the mortuary, you will book porters, and they will come whenever they are able to and take the patient down. That is pretty much a whole run through of end of life care, literally start to finish. I hope it has helped you get an understanding of how we look after patients who are actively dying. It has been quite a sad topic, I understand that, and I've said it in quite a, I don't know if it sounds uncaring or not, but I'm not being funny. At the end of the day, people die, and it is really sad, and I do get upset by it, but it needs to be talked about in a direct way so that people understand end of life care. You know, if you have learnt something from this video and would like to learn more, feel free to subscribe and turn the notifications on. I'm going to be doing a few more videos like this explaining certain things that I do, but as an elderly medicine nurse. If you have any questions, feel free to put them in the comments down below, and if there's any videos you'd like to see me make, then please leave suggestions in the comments as well. I will see you in the next video. Take care and have a nice day.